Welcome to the progress note portion of the SOAP note writing workshop. It's now the next morning, and you get a call back from the radiologist in that morning with an official attending read of a CT soft tissue neck showing laryngeal cancer in the subglottic area. Let's say you go in and see your patient, you ask them some questions the next morning to get your subjective history. Then you look at the vitals and the labs to review some of the objective stuff. And you'll note on objective, the labs now show a creatinine of 1.5 up from 0.9 yesterday, and a hemoglobin up to 13 up from 8.6 yesterday. Now it's your chance to go ahead and write an assessment and plan for this progress note for this next day. Please take 5 minutes and write a progress note for this next day, just the assessment and plan portion. Now that you've written your assessment and plan, if you still with your partner, go ahead and take 2 minutes and share your assessment and plan with your partner. Now here's a sample SOAP progress note for the next day in terms of the assessment and plan. So once again, you still have your assessment, also known as a summary statement or problem representation. And you have an 86-year-old male with a history of hypothyroidism who presents with throat pain, dysphonia, and weight loss, now with laryngeal cancer. Note that this part that's highlighted here has changed compared to beforehand. Now onto the plan where beforehand we had a problem, right throat pain with dysphonia. Now we replace that with laryngeal cancer since we know what it is now. And then you're supporting for that, including diagnosed on CT soft tissue neck and dysphonia, dysphagia, and right throat pain. And then your plan portion is ENT consult regarding fine needle aspiration, continued IV morphine, and speech therapy consult for swallow eval. Now please note that he still has his other medical problems that we have to address, including his hypothyroidism, and the plan is now changed to get a thyroid ultrasound and a fine needle aspiration. His anemia has actually now resolved, and you can say his hemoglobin is now 13, so we can just monitor that for now. A new medical problem is that he has acute kidney injury now, right? Remember, his kidney creatinine is now 1.5, up from 0.9, and you can say new, likely pre-renal, given difficulty swallowing fluids previously. And so you can do things like get a FeNA, like you learned from Werner, renal ultrasound, IV fluids, and a Foley catheter. The FEN prophylaxis portion is still there, and you can still say MPO at midnight for procedure now. And other parts of the plan are still the same, like whole person care. And once again, let's say you've offered prayer and patient found it helpful again, you can put this again. And disposition, await ENT recommendations. Here you have it all in one place, the assessment and plan for your SOAP note for the progress note for the next day. Note that there are differences between an H&P assessment plan and a progress note assessment plan. Most significantly here on your H&P, you had a differential on there, but now that we know the diagnoses, the assessment here actually contains assessment of laryngeal cancer. It no longer has a differential on there. On the next video, we'll talk about the difference between problem-based notes and systems-based notes.